Well, I think the Cleveland Clinic London and the brand itself is all wrapped around the patient. The patient's at the centre of all the care they do. I believe that the consultants uniquely are very, very involved in the management of the Cleveland Clinic London as well as the worldwide brands. And again, that's a fantastic thing. You've got clinical input from literally the design upwards, from the footing of the new hospital they've built in the centre of London, all the way through the design of the services. I think general practice is a very unique speciality. We are what's called the generalist specialists. We deal with everything from cradle to grave. Most days of my working life, I will see all specialities. We never really know what's coming through the door, so I think that differs us from many specialities where, you know, most consultants will be referred a patient with a specific problem. They'll arrive with a referral letter. They may well have a formal diagnosis already. They're having a treatment plan. In general practice, people come through the door. It's literally just, you know, you don't know what's going to hit you each time. It could be a rash 1 minute, a breast lump the next minute, a sick child the next minute, a depressed patient the next minute. So the variety is endless. It's ever stimulating, and the patients come in. You need to sit, listen, assess what's going on, try and learn about the patient, try and work out what their anxieties, their concerns are, what they're hoping to gain from the consultation. And actually, in many times that process takes several consultations. It doesn't always happen on the first meeting. And certainly for me as a GP, I've been in the same job for 20 years in my main place of work. You get to know people over decades and in fact generations. You get to know the family, you get to visit them at home. You know, the job crosses the boundaries of the office to the home. We look after people through end-of-life care, through pregnancies. It is really a unique speciality. I think people need to be reassured that nothing ever shocks the GP. People often come and say, I'm really embarrassed about this, or I've never spoken to anyone about the other. I mean, you can say whatever you like to a GP in a room. It's not going outside the room. I think that's lovely for patients to know they can just come in with anything they want, and we will try and help them. If we don't know the answer, we'll point them in the right direction, and we will hopefully deal with it ourselves, but if not, we'll arrange further tests, investigations, and then we'll refer on to one of our amazing specialist colleagues as needed.